So last week we focused on deep diaphragmatic breathing. So when you get back into your sitting position, remember you're sitting really grounded in your space, and you've got that space where you could sit a little bit more forward with your pelvis. So make sure, and even if you want to kind of pull the tissue away from your glutes to help ground, bring that pelvis forward, but then tighten your tummy just to help kind of support your back. And then it's like the head is being drawn up towards the ceiling. So you're feeling nice and tall, sitting nice and supported. You're going to notice your breathing again. Try to breathe in through your nose, nice and gently, pausing and then exhaling through your nose. So check in with your breath, get your sitting posture, and then we're going to do the three life affirming bandhas, the yoga contractions that we use a lot in physical therapy. So the first is essentially cervical retraction, where you're wanting to make a double chin. The second one is a tummy tightener, where you're drawing in your deep layer of abdominals. You've got 4 layers of abdominal muscles, and we want that innermost layer. And then the last lock is the Mula Bandha, the pelvic floor contraction. So go ahead and get yourself nice and seated. Check in with your body. Start with that really beautiful, long, deep belly breath. Try to fill in all of the areas of your trunk and your abdomen. So focus on bringing the air down deep into the bottom. We're doing that 360-degree breath where you're trying to fill everyone up, bottom, middle, and then finally inhaling, lifting kind of the chest, the clavicles, and top. Uh, in the back, think of the areas behind your scapulas just filling with air. So then for your first bandha, you're going to think of drawing your head straight backwards, like you're making a double chin. And you're going to feel this, the muscles tighten in the back of the neck. So you're just going to draw in and then relax. Draw in, relax. Drawing in again. I like to call this one ugly person coming to kiss you. So you're just putting your head straight back. Oh, thank you. From the side, you'll notice a little straight back. Most people want to tip up or back, but really, we're just trying to draw back nice and gently. This is really fantastic for all of these, keep energy kind of locked in our bodies, in our spine area. So that's why bandha means lock in Sanskrit. So then the next bandha is the tummy tightener. So with this one, if you just draw your abdomen in, so you sort of just like collapse, usually when you think of like a big belly tightening, that's rectus. That's the muscle that's the most on the outside, like our six-pack muscle. So I don't want you to use that muscle. I want you to think very, very lightly, only using like 20% of what your muscle contraction is like, where you're drawing your belly button in towards your spine. Try to keep the rest of the muscles kind of quiet and only focus on the abdomen. So you might kind of feel your pelvic floor want to come up and assist. And I like to take the transversus abdominis contraction away from the pelvic floor contraction. So you're only just, it's like you're lightly tightening, like someone's going to punch you in the tummy. All these nice things. So just contracting lightly and then letting it go. And in this one, you'll see there's no movement at all. because it's very, very light. And I like to contract for maybe 2 or 3 seconds and then relax for about 2 or 3 seconds. And it's only that deep abdominal muscle. So if you notice any movement, do less. Sometimes when I'm teaching our yogis how to do this contraction, I'll tell them, imagine you're doing the muscle contraction, and that'll usually get it. And the last but not least bandha is pelvic floor contraction, the mula bandha. It's called the root lock. So it's at the root, at your root, base of your spine, base of your pelvis. So first take a couple nice deep breaths and just orient yourself to your body. When you do that deep diaphragmatic breath, your diaphragm contracts. And when you have that big belly bulge, that's when we know that your abdominal contents and your organs will bulge into places where there's soft tissue, muscles. So you'll have that bulge here because there's no muscles in the abdomen. But then you'll also feel, if you're really attuned to your pelvic floor and your body, you'll feel your body bulge at your perineum, at the bottom of your pelvis. So right now you're sitting on your two ischial sits bones on the sides. Your pubic bone is in front and your tailbone's in back. So if you just kind of orient to where you're grounding in space, everywhere that you're sitting is muscles, is soft tissue. Besides the ischial tuberosities on the side, pubic bone in front, tailbone in back. When we're sitting and we're sitting well, you really should only be feeling those two ischial tuberosities. If you're really tight and tucked back and you feel yourself sitting on your tailbone, remember that's when we get a bolster or we do this in sitting in a chair as opposed to on the ground. So notice your breath. Get that really big belly breath. And hopefully your brain and your body connect where you could feel on the inhale that your pelvic floor drops ever so slightly into the floor. And on the exhale, there's a gentle recoil. We're actually looking for that. We're looking for movement. We're looking for elasticity in your muscles. Of course, if there's any leakage or pain, please stop. And then after you notice that you have that really big, beautiful breath, perhaps on the exhale, you try to pull and pick up your muscles and lift them away from the ground. Inhale, relax, and the muscles get nice and long. And we're talking about the muscles of your pelvic floor, the muscles that you're sitting on right now. Relax and let the muscles lengthen. The inhale. And on the exhale, gently try to pull all the muscles up and into your body. Notice if you're squeezing your glutes or your tummy, or some people like to kind of like contract with their eyeballs or their toes will curl. So really just notice in your body where you're trying to contract with your pelvic floor. So we only want the pelvic floor muscles to contract in this exercise. And if you find this really hard to do, how I like to tell my yogis to find this muscle lock is to pretend that you're in an elevator and that you do not want to pass gas. So you're going to kind of hold your anus up and in. Most of us have good connection with our brains to our anus. So we may not, depending if you're born biologically female or male, we may not have more of the awareness to the more anterior muscles. But remember, you're just going to pull up and in on the exhale, like you're trying not to pass gas. And then notice the relaxation and the opening on the inhale. So you can try that to see if you could find these muscle contractions, which are My favorite. And then last or not least, if you've connected with your muscles by controlling kind of that gas feeling on the exhale, try to bring your awareness to the muscles more forward, like I just mentioned. Just see if you could pull up and in at that location. Inhale, relax the muscles, drop, elongate. On the exhale, you're going to pull up and in. And then on your next exhale, just relax everyone and everything. Check in with your body. Make sure that everything feels really good, really comfortable, really wonderful. Know you can give yourself time for your breath at any time during the day. Most of these contractions you can do without people knowing you're even doing them. The cervical retraction one's a little like, what are they doing? But it's so good for your body. So I hope all of these little exercises helped you feel good and empowered, and they're just something that you can maybe pause and do during your day. Thank you.